Welcome to my channel, The Fit Hub. I am telling about valley fever. Valley fever, medically known as Coccidioidomycosis, is a fungal infection caused by the Coccidioides species, primarily Coccidioides immitis and Coccidioides posidacea. These fungi are found in the soil of arid and semi-arid regions, especially in the southwestern United States, such as Arizona, California, Nevada, New Mexico, and Texas. The disease also occurs in parts of Mexico, Central America, and South America. How people get valley fever. Valley fever is contracted by inhaling microscopic fungal spores that become airborne when contaminated soil or dust is disturbed. Activities such as construction, farming, gardening, or even strong winds can release these spores into the air. Once inhaled, the spores settle in the lungs, where they can cause infection. Valley fever is not contagious. It cannot be spread from person to person or from animals to people. People who live in or travel to endemic areas are at risk, especially if they spend time outdoors or are exposed to dusty conditions. Those most vulnerable to severe forms of the disease include individuals with weakened immune systems, pregnant women, especially in the third trimester, the elderly, and people of African or Filipino descent. Symptoms of valley fever. The symptoms of valley fever vary depending on the individual's immune system and the severity of the infection. In many cases, especially in healthy individuals, the infection is mild or asymptomatic, and people recover without realizing they were infected. When symptoms do occur, they usually develop 1 to 3 weeks after exposure and can resemble those of the flu or a respiratory infection. Common symptoms include fever, fatigue, cough, chest pain, shortness of breath, headache, chills, night sweats, muscle or joint pain, loss of appetite, weight loss, skin rash, which may appear as red, painful bumps, erythema nodosum, especially on the legs. In most cases, the infection remains limited to the lungs and resolves on its own over several weeks or months. However, some people develop more severe illness that requires medical treatment with antifungal medications like fluconazole or itraconazole. In rare cases, the fungus can spread beyond the lungs to other parts of the body, such as the skin, bones, joints, or the central nervous system, CNS. When the infection spreads to the brain, it can cause fungal meningitis, a life-threatening condition that requires long-term treatment. Conclusion: valley fever is an environmental disease caused by inhaling fungal spores found in dust from certain dry regions. While most cases are mild, symptoms can range from flu-like illness to more serious complications in vulnerable individuals. Awareness, early diagnosis, and treatment are key to managing the disease, especially for those who live or work in high-risk areas.